Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or are seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. Nicole laughs at me every time now since I have to count down because the countdown doesn't show up anymore.
And then she points at me like, it's your turn.
Your turn. You're on. Like, doesn't have to do in the news. Like, they point at them.
So, hi, how are you? It's been
I know.
a minute. We were
It's
just
been
saying.
a while. Where we are in time, we are in early June. Listeners, you will be in mid-July. That is
We're
our
ahead of the
time warp.
game.
We are. But right now, you are all enjoying your nice, lazy summer, and I'm in like the heat of end of school year parenthood craziness with 2 kids graduating and just all of the events and things and stuff. So it's a little cuckoo.
I mean, we're going to talk about cuckoo today, so
Well,
it's fitting.
yes, that's
It's fitting that you're a little cuckoo, but it is what it is, Tis
You know,
the season.
it's a thing like, the mental load of like, we have this, tomorrow's a field day, this one has a beach trip, we have a banquet for this, we have recital pictures, we have, and it's like, my mind is like.
You had, if I saw correctly, prom or some formal
No, it's
event?
eighth grade
Formal?
dance, like, but the parents go. Yeah, it's like dressy. It was at like this nice place in our area. And,
I know when I first saw it, I was like, she's too young for prom, but it's something of
it's an
that
8th grade event,
flavor.
but you pay like you would for that, like per head, and they have DJ and they all dress up, and the parents go, but the parents just are not with the kids. The kids are off there doing their own thing, so,
which I'm sure they prefer.
Yeah, so she partied the whole night, danced the whole night. She got a little upset because 8th grade boys are still the same as 8th grade boys were 30-something years ago.
Yeah. You didn't have to age us like that. I feel personally victimized.
They were jumping all over and like, I don't know, fake moshing on the dance floor, and she got knocked down and her strap on her dress got ripped and she was upset. But her friends, her girls,
I mean, I'd be more
out.
upset she doesn't want to re-break her foot, but okay.
Yeah, true. But, her girls helped her out and they tied the strap and like we went on. But, it's just one of those things. Boys mature slower than girls, and
boys will be boys, unfortunately.
It's actually hysterical. Like when you watch them in the wild, like
in the wild.
I mean, I don't have boys, so I don't know, but like seeing the way the girls are more mature and then the boys are all like, goofy and like whatever, they'll catch up. They'll be cute.
I will say from the therapeutic standpoint, the most difficult group that I have working with are those like 9 to 14-year-old boys.
Yeah.
They're just they just test me and they love it. And I have zero patience for it.
Right? I'd lose my mind, I think. I mean, I have enough with attitudes and talking back with girls, but I don't know. I think
Well, it was funny. One of the psychometrists at work, the person who gives the psychological testing, I was telling her, I like this group, I don't like that group. And she was like, oh yeah, those like preteen boys, they always flirt with me. And I was like, what? Really? I mean, like, she's like very attractive, so I understand why, but it's like, they have the balls to do that?
I don't know.
To flirt with a grown woman? Okay, good for you, I guess. I don't know. It's awkward.
That is a little bit much.
Mm-hmm.
So anything new on your front?
New on my front. Well, I did find something in the store that reminds me of you, and I don't think you know why it reminds me of you, but I'm going to show it to you.
I'm scared.
I am showing Tara Gummy Lifesavers.
Okay.
Do you know why this reminds me of you?
No.
The very first time I ever tried a Gummy Lifesaver was on our road trip.
Oh, wow.
Yeah.
That's a famous road trip with my niece that we were singing Black Eyed Peas in traffic. And she was like, I don't know, like 9 years old or something at the time.
Yeah.
We're like, my homes.
My lovely lady lumps.
Trying to get the trucks to like honk and stuff. Oh, that was quite memorable.
Good times, good times. But yeah, apparently we had made a stop at like a convenience store or something
Right.
and probably got gas. And
Yeah.
I'd never tried them before. I feel like you had them and you're like, oh, get them. They're good. And then I tried them and I
Probably.
was like, what is this magicalness?
Yeah, I probably did. That's back
Yeah.
in the day. I don't think I've had them in any recent years. So now I'm going to have to go buy them because
You
now
are.
I
Well, they're
remember.
everywhere because the minute I saw
We
them
were
and I bought
somewhere.
them, and I was like, oh, these are good. And now I've seen them everywhere.
Yeah. We're doing that thing where we're not quite synced in our lips, and that was torture. So I hope it fixes itself. Let me see you talk again.
You're synced for me. You're
Okay,
fine.
you're okay. You're off by like a millisecond. No, there was that one time, and my husband had to save the day because I was about to throw the computer through the wall, where that whole episode I was talking before you even asked the question. Like it was it was like, help, how do I fix this? I was like, can you look at this? And sometimes like another set of eyes. He's like, if you hold this over here, it turns into a hand and then you can drag it. I'm like, thank you. But like, I don't know. It was not fun. So I have a fear.
I get it. I don't blame you. So that was one thing that was going on. Otherwise, not too much. Been very, very, very minimally, but also not minimally. House hunting. Nothing's really worked out yet. So no exciting news to report, but it is what it is.
Keeping your eyes out there looking.
Yeah. I'm supposed to go see a property tomorrow that is very close to work and in a very nice neighborhood. So that's good potential. But the way that it's listed is that it's an investment property.
Ooh.
So that means it needs a lot of work.
Yeah. So that's hard.
We'll see what they mean. If it's just like cosmetic stuff like that, I'm willing to do because it's not like at the top of my budget. But if it's like needs a new roof, like crazy stuff like that, no, thank you.
Yeah, no thanks.
Yeah.
So one of the things we got to update our friends about, which hopefully you'll see this before you hear this, is that Nicole found us a little partnership with Comfort, who makes the really cool hoodies and sweats. And I'm currently wearing a Comfort hoodie. My kids had
Even though it's 92 degrees outside, she's wearing a Comfort hoodie.
The air conditioning is blowing on me in my office, but the kids have had them and they've been wearing them. And I was like, you know what? Now that we have a partnership, I'm getting my own. Yeah. So I immediately ordered it and got my own so I can speak for it myself. And I love it.
What, you like it?
Yeah, this is their signature, I believe it's called, which is like their like basic, simple. I got a smaller one. You could definitely do bigger for oversized. But this is like just right, perfectly comfy and soft and well priced too, actually. It was a pretty good deal. So,
and they always have like sales and stuff. So they're a great site. And what I really like about them is one of their main like mission statements, one of their main goals for their company is to support mental health and wellness, meditation, getting mental health help. So that really speaks to, what I do every day. So I had already had some comfort pieces from like, I think I first found them like 2 years ago. I got some sweatpants and then some other items. So when I saw that they were looking for ambassadors, I jumped at it because I'm like, well, I already love your products. So
that makes it easy.
Yeah. Easy peasy.
So you guys can find the link with our discount code. It's on our website. It's in our show notes. It's on our link tree. It's everywhere that you can find us. It's there. So find it.
Yes, find it. Get some nice, comfy stuff. They just released some things that seem like they might be lighter weight for summertime. If you're looking for something to wear now. So yeah, check it out.
I always like comfy stuff like this for travel too, because it's like the airport, the plane, you're cold. I want to be all snuggly. And so,
well, that is what I have. I talked about on our little promo that I did. Right. I have the airplane hoodie, which is a hoodie, like a zip up, but it has the eye mask built into the hood. Yes. So like if you're on a plane or on a train waiting in the airport, something like that, you can just pull your hoodie up, cover your eyes, take a nap, relax.
I should get that one before we come home from Alaska overnight. Yes. That's probably a good idea since I have to try and sleep on the plane.
Yeah.
Which I sleep all the time everywhere except for planes, trains, and cars, apparently. And so that's not
planes,
great.
Trains, and automobiles.
Yes. And for traveling in this direction, you really need to sleep because the flights tend to be overnight from west to east. So fun stuff.
You'll figure it out.
Yeah. So what kind of kooky stuff we got going on today?
So today, I'll tell you about my drink first. I am drinking the Bipolar Christy. So guess what I'm talking about? I'm talking about Christy. No, although if you've seen the movie Christy, I did consider covering that, but that's not what I'm talking about today.
What's the movie Christy? I don't know the movie.
Christy is a movie that came out, I want to say like 2 years ago, starring Sydney Sweeney, who I have mixed feelings about. But it's a true story. It's a biopic.
I know. I say that different ways. Don't
Yeah,
ask.
she plays a boxer whose first name is Christy. I'm blanking on her last name.
Yes.
It's a very interesting story. I watched the documentary, and then when the movie came out, I watched it. But she was a boxer who was one of the first very famous female boxers.
Mm-hmm.
But her manager was physically and sexually abusing her and attempted to kill her.
Yep.
She survived and took him to court. And then it's a survivor story. The documentary goes more into her survival story versus the movie is kind of just up until like she ended the relationship and like her comeback per se.
Interesting.
So interesting. I considered covering it because I do know a lot about domestic violence and the cycle of violence and stuff like that, but it felt like a little bit of a downer.
Yeah.
But maybe I'll cover it in the future. All of my topics are not always fun and exciting and just important topics to talk about. So, but today my drink is the Bipolar Christy, and it is a really simple drink. It is 1.5 ounces of vodka, 3 ounces of pomegranate juice, 2 ounces of lime juice, and then you garnish. Wow, words have been hard the last few days.
Yeah, it happens.
Garnish with pomegranate. So I got like the pomegranate
the little
seeds.
things. Mm-hmm.
Yeah. And then I also garnished with a little bit of dried lime wheel because I had that. Basically pour it all into a glass, stir it, you're done. I put some ice in it too, just because my pomegranate juice wasn't like ice cold. So, but it's pretty tasty.
Pomegranate juice. I just don't think about using it. Like I like it. And pomegranates themselves, there was like a point a few weeks ago where my whole family was just eating them nonstop. And then they go through a phase and then they like forget about them for another year.
Yeah. Yeah, I like it. I will say, looking at the ratio, there's quite a bit of lime juice. So it is kind of tart, but not in a bad way.
Okay.
I think if I made it again, I would put a little bit more pomegranate juice than lime juice, but tasty.
Cool.
So with the title, like the Bipolar Christy, I think you can guess I'm going to talk about bipolar.
Yes. And I want to hear about all the famous people you're going to talk about.
So that's what I was going to say. Today, I'm doing a little bit of a different tack than normally, where I'm not talking about specific movies or TV shows. I'm talking about celebrities that we all know and love who have come out as having bipolar.
Yes.
So the first one I want to mention, because she has not confirmed nor denied that she has it, it is suspected that my love Britney may have bipolar.
Yes.
I am not diagnosing her. I don't know if she does, but that's kind of all I'm going to say about her.
Right.
People, celebrities who have publicly stated that they are bipolar include Mariah Carey, Kanye West, and I have a whole long list of things. But the reason I decided to talk about this is, at this point, because I do my notes so far ahead of time, back in January, Kanye came out and said that a lot of his misbehavior was due to a manic episode of psychotic, paranoid, and impulsive behavior. And that was when he was making those anti-Semitic comments.
Yeah.
And so he's saying that during that process of this manic phase of bipolar, he became psychotic, lost touch with reality, and was making these comments.
Yeah.
Now, that being said, I am not at all doubting that Kanye has bipolar.
Mm-hmm.
That being said, Kanye has always been very controversial, pushed the boundaries, things like that.
Yes.
So I don't know if some of these statements were fully that, but he's saying it, so I'm taking it for what he says.
Right, right.
That being said, as I read further in the article, I was like, Kanye, what? Because he then makes a statement. I'm going to just read the quote. I'm just reading it as it is because no, ma'am. He says, "It's not just me who ruins their entire life once a year despite taking meds every day and being told the so-called best doctors in the world that I am not bipolar, but merely experiencing symptoms of autism."
I don't know.
I am not Kanye's doctor. I've never met him in person.
But you are an expert in autism, so.
I am I am a certified autism spectrum disorder specialist. I can say that, not just because I've worked in the field and do this every day. From what Kanye portrays of himself, he does not appear to have autism. Maybe he's real good at masking. I don't know. But a lot of the erratic behavior that we've seen does fall a little bit more neatly into the bipolar bucket.
Absolutely.
Especially given if we're looking at Kanye's quite prolific career, if we're being honest. A lot of the symptoms started to come up around that same age when we see that, mid to late 20s. That was when we saw him kind of go off the rails. Definitely, I think a lot of things were tripped off when he lost his mother tragically, and which can be more common. So with bipolar and things like that, especially if you're in that prodromal phase where you're showing those prior to full-blown symptoms, there's certain other symptoms, and then trauma or other difficulties can kind of kick off that process. So my opinion, which is only my opinion, and it's not a clinical opinion, this is my personal opinion, is I don't think Kanye has autism, but this is what he is saying in this article.
Right.
I also say that because I think the episodes of meltdowns that we've talked about, autism meltdowns before and things like that, have just a really different quality of them that we have not seen from Kanye. Again, he's a professional and he is talented and he is in the public eye. And so maybe he's learned to hide some of those things, but it does not appear to align with that.
Yeah.
And I only say that because he is a public figure, and I'm sure there's a lot of people who look up to them. So I don't want them thinking, I don't have that, so I don't have autism, even if they've been diagnosed, or vice versa. I do that, so I must have autism versus maybe bipolar or schizophrenia or something else going on. So that's Kanye's story. And there'll be 2 links to show notes about Kanye, but he is not the only celebrity who has come out with having mental illness, specifically bipolar. Another one, I think you know this guy. If you don't, I got concerned because I know you quoted some songs from him. But our friend Gucci Mane. When you did our Scissor episode, you talked about Gucci Mane.
Yes.
So he did come out as having been diagnosed with schizophrenia and bipolar. Again, he's saying that. I'm taking that for what it's worth. But a lot of times people tend to have one or the other, not both.
Right, not both.
So, but we've heard of a lot of celebrities being told that they have both. It also probably depends on what professional you see first or what symptoms they're presenting with. But typically, that's kind of contraindicated to have both. It's typically one or the other.
Right. Absolutely.
Another person who I did not know had bipolar, and I don't know if I gained a new, I'm sorry, he doesn't have bipolar. The article started off with celebrities bipolar, and then it's got other mental health issues. But since I just mentioned it, I'll continue the sentence. Our friend Penn Badgley, who is from You, he is from Gossip Girl. Do you know what he has? He has spoken publicly about it.
I don't know. I don't know his personal life. I just know him as an actor.
He has body dysmorphia, which we covered in a prior episode. So that was why I just kind of continued on it, even though it's not bipolar.
Yeah.
But he explained about his struggles with that. I'm just trying to scroll through because this article was mislabeled. And clearly I only scrolled halfway down. So
that's
else?
okay.
I have another article that is specific to bipolar, but I'm just looking at this. If anyone's looking at any sort of video, if you use this clip, I was making a weird face because
I won't put
it was
in.
like Katy Perry, and then it talks about COVID. I'm like, girl, what is this article about?
Nothing. It's clickbait.
E-News. What have you done to me here?
Yeah.
Oh, well, this, not bipolar, but I think a lot of people sometimes mistake some of these episodes for bipolar, but severe anxiety.
Mm-hmm.
So Kendall Jenner came out as having severe anxiety, which they did cover on Keeping Up with the Kardashians or The Kardashians, their 2 shows. And I don't think her anxiety necessarily comes from nowhere because she was the victim of quite a prolific stalker for some time.
Right.
And so that can definitely, if you don't have anxiety, that can definitely lead to some. I also would imagine with any of these folks, being in the public eye and being truly famous where people know you by your first or last name or can spot you on the street, that's got to stir up some emotional things in you. And then, a lot of people are just biologically predispositioned to one thing or another. These other folks are not bipolar, so E-News failed me on this article. I'm just scrolling to the end to make sure I don't miss anybody. There's a lot of celebrities with PTSD, anxiety, depression, which maybe I'll cover in another episode, OCD. Okay, I'm giving up on this article. If there's other people in this article, I'm sorry I missed you. I'm sure you're listening because celebrities listen to us.
They do, absolutely, positively. They're right here. They're with us.
Like I said, I've said it before. I'll say it again. Brittany, if you're out there, I love you. So there is the Kanye article that I talked about. There's something else about Kanye that I wanted to say that I couldn't remember. So this was a long, long time ago. Do you remember when Kanye broke his jaw and he had to have his jaw wired shut?
Yes.
And then he still rapped?
Yes.
So he broke his jaw during a car accident, but he also suffered a right frontal lobe injury, which that can also cause some issues. But then he said that some of that neurological damage wasn't noticed right away, which is very common with head injuries. Right. And then he says, these again are Kanye's words, that medical oversight caused serious damage to his mental health and led to his bipolar type 1 diagnosis. So he's telling us he's diagnosed with everything. I'm not saying it, he's saying it.
Right. I mean, there's unfortunately not much you can do about that brain injury, right? Unless there's an active bleed, there isn't really anything medically you could do.
Right. And depending on, if he's coming in with his jaw broken and all those things, they're going to address the most severe injuries first.
Right. But they CAT scanned his head.
Right. They're going to do CAT scans. But if that injury was not, visible on a scan or not as significant as those other injuries, they're going to treat those more severe injuries first, which they should.
Of course.
If you have a really bad car accident and have a head injury, but your hip is broken in 3 places, they're going to fix your hip first.
Right.
So it's, some of it, and I don't think he was being negative towards that. He was just saying, this was my process of getting there. The other thing about Kanye, which I think a lot of people have seen, So this is no shade to him. This is just factual. We've seen him be very erratic in interviews, on stage, and doing things like everybody knows the whole Taylor Swift issue at the
Yes.
VMAs where he stole the award from her or
Yeah.
tried to and all that stuff. So I think Kanye's instability, despite knowing exactly what it's from, other than what he tells us, I think it's been very publicly acknowledged.
Yeah.
And I bring that up because I do feel like at certain points in his life, especially during his divorce/separation from Kim Kardashian, I feel like maybe some of the people on his team were kind of feeding into his crazy. You know, they were
Right.
using that for publicity.
Publicity.
And,
Absolutely.
you know, I would hope that he has control over some of what is released about him, but I also worry that maybe some of the folks around him are not really supporting his mental health and his help, because part of what I'm going to get into later is that fine line between really intense creativity and bipolar.
Yes.
And a lot of people who have bipolar feel more creative when they're in these manic episodes. And so they tend to stop taking their medication or stop following their treatment regimens. And so I can see how maybe if he wants to write a new album, he might make some of those choices. But then it's like, who's allowing that though? Because it can be very dangerous to have a manic episode. You can be very impulsive. You can be very reckless. You could hurt yourself or someone else unintentionally. Like, I'm not saying suicide. I'm just saying, I'm going to go do this. And then something bad happens.
Absolutely.
And again, I don't know Kanye. I'm back and forth about him. I will say College Dropout, amazing album. He's not had a good one since then.
No,
he's had good albums, but
he definitely changed things. He brought new things to the game as far as when it comes to music, for sure.
And he's still very creative. You know, it's not always my thing, but I acknowledge that he is a very creative, talented person. But I sometimes wonder how much of the people close to him are really looking out for him and taking care of him versus almost exploiting him for this behavior, to be in the news, to then get views, to then get listens, for people to buy his album, to buy his clothing line, all that kind of stuff.
Absolutely.
What I do like about, and I'm going to move on to another celebrity, but in this People article, also talking about those anti-Semitic remarks and when him coming out about his bipolar, I do like what he says at the end. I'm not asking for sympathy or for a free pass, though I aspire to earn your forgiveness. I write today simply to ask for your patience and understanding as I find my way home.
Okay.
Which I think is really important because, as we kind of alluded to before, I think him losing his mother, who we all knew he was very close to, he was very public about that. I think, you know, trauma causes a lot of unruly behavior too. So even if that tripped off bipolar or something else going on, you don't lose the trauma of losing your mother like that. You just learn to cope with it better. And maybe he's coping with it better or worse at certain times.
Absolutely.
The other thing too about Kanye, despite political leanings or his outrageousness, he's got several kids and he does seem to care very deeply about his children. So hopefully he can get his stuff together for his kids, for the rest of his family, for his career, because he's got a lot of talent. And, you know, he can be a great role model for some people when he's at his peak, but it's those ups and downs that can be really difficult.
You'll probably go into it at one point, but like, I feel like a hallmark of bipolar is poor insight into how it's affecting,
especially during those manic episodes.
Yeah, into what's going on around you and how it's like rolling out into the rest of your life.
Yeah. And I think that's something that we talk about, the lack of insight during the manic episodes. But I think what happens with a lot of people with bipolar is almost enhanced insight during those depressive episodes, and then feeling the guilt of, I can't believe I did that. I can't believe I said that, which then pulls you down even lower and makes it hard to climb out of that depression.
Right. And there's also the, I'm doing better, I'm feeling better, I don't need
my meds. Exactly.
And then we end up back
which is not alone to bipolar.
No,
it happens in many disorders.
Yeah, but it's just one of those like, we got so good. We were so close. You were doing so well.
Yeah. So another celebrity who came out as having bipolar, which I just love this full circle moment, is Faye Dunaway, who portrayed you know where I'm going, Joan Crawford in Mommy Dearest.
Yes, Mommy Dearest. We're coming back. Wait, you have your Mommy Dearest stuff?
No more wire hangers. No more wire hangers.
Where's your Noxzema, okay?
It's in the bathroom. Yes. So Faye Dunaway, which I did not know, Mariah Carey, which we've talked about. And I feel like, I don't know about you, I was always a big Mariah fan. So when she came out publicly and talked about it, I really paid attention to it. Yeah. I feel like it kind of got glazed over. Yeah. When she came out with bipolar. But there's one very specific incident where Mariah was off the chain and it was caught on film. Do you remember what it was?
I don't.
It was when she did her Cribs episode. Remember, she was showing them around her house, and then she stripped down into a bikini and got in her bathtub.
Yes, I remember this now. Oh my goodness. Yes. I remember I could picture in my mind
Yes.
everything she did on that episode.
Yes. And I will say, Mariah, I really love her because I think she's a diva, but I also think she's earned it. She's got the talent to back up her diva status.
She's the GOAT.
But I think until that point, she was very, very private about her life. And then after that happens, I don't think it was immediately after that she came out with her bipolar diagnosis, but she did. In 2001 was when she said that she was diagnosed with bipolar. And she said that she lived in denial and isolation for years about it before finally seeking treatment. After a series of professional and romantic issues.
Yeah.
So I would assume the professional issue was that Cribs episode because that made a big splash. But I know she had a lot of relationship issues going back and forth. I feel like she was well diagnosed and treated before she got married to Nick Cannon. So just remembering the timeline. But I feel like by then she was a little bit more stable.
Nick Cannon's a whole nother subject, not so a psych subject.
I was going to say
he has lupus, but he also has like 10,000 children.
Actually, I did know he had lupus.
He had a kidney transplant, but he also has like 10,000 children.
Like, yes, literally. Many, many, many babies. I saw a joke that says Nick Cannon has more babies than cranberry juice. Because you know how cranberry juice is always mixed with everything?
Yes.
Nick Cannon has more babies. I'm sure
he makes cute babies, but you know.
He does.
I mean, him and Mariah, that's a good looking pair.
Yeah, yes. And what I do like about, this is a tangent, but what I do like about Nick Cannon is that he's always very respectful about Mariah, and it seems like they have a good co-parenting relationship.
That is true. That's true.
Yeah. And, you know, sometimes it happens. People, they try it. It doesn't work out. At least you can go your separate ways and still be positive about it.
Yeah.
So Mariah came out with bipolar. I think she's been doing relatively good since then. Oh, that's what I was going to say about Mariah. She had a not very popular reality series. I don't know if you saw it. It was following like one of her tours. But what I like about Mariah is she will make fun of herself like nobody's business. She will mock herself. Like there's one interview where she comes out in lingerie and she's like, well, what else would you expect? She's like, I'm Mariah Carey. Or like there's one where she puts on a wig and pretends to be somebody else talking shit about Mariah. And like, this girl's funny. Like she's funny.
There was something more recently I saw her in and she looked really good. She sang very well. Was it New Year's? Was it something?
She did do New Year's this past year.
Maybe
but she's done it several years.
Yeah, but I think a couple years ago I was like, but this most recent, I feel like she was looking good, put together, singing well, like just
Mariah still got it. She still got it. Yeah. Another person who I do feel like this was not private knowledge, Carrie Fisher.
Yeah.
The actress.
Yeah.
She was diagnosed with bipolar when she was quite young at age 24.
Yeah.
And she still had a prolific career after that.
Absolutely.
This one I did not know.
Mm-hmm.
Bebe Rexha.
Okay.
I
don't know her personal life. I just know her songs.
All I know is that Bebe's put on a little bit of weight, but she is feeling herself.
She has
and girl looks
curves.
Fierce.
She has a nice look.
Gorgeous curves. But there was some interview where somebody was asking her, like, well, what do you say about your haters? And she was just like, you can't handle all this. And I was like, yes, queen. Yes.
I think, though, I feel like I don't know, at some point I was looking her up for some reason and she came up back then as being, even before she gained this weight, being like looked at as heavy, being like a size 8.
When she wasn't.
And I was like, a size 8? There's nothing like.
Right. And we don't know what the cause is for her weight gain, nor should we care.
Right.
And I personally don't care. Honestly, I think she's better curvy. I'm like, yes, girl.
Gorgeous. Yeah.
And yes, and she's stunningly gorgeous. But one thing I was going to say is a lot of medications for mental health issues, especially bipolar, can cause weight gain.
Absolutely.
And so as long as she's healthy, physically and emotionally, I don't care what size you are, girl. Be a size 0 if you want to be a size 20 if you want to be. Just own it and love it. And that's all.
And as long as you're feeling good and feeling yourself, and especially getting her mental health in check, like go for it.
Yeah. And so she came out and said that she is bipolar and she's not ashamed about it anymore. And then went on to say how she tries to use her creativity towards her album. She didn't say anything about like going off of meds or anything. But as I was alluding to before, a lot of people who have bipolar are highly creative. And so I'm glad that she's able to use that as an outlet for her career to be successful. And I will say, I keep forgetting the name of her new album, but I keep hearing the songs on TikTok and they are bangers. I need to download it. They're so good. I want to say it's the Kia Asylum or the Kaya Asylum, Khia Asylum. But they're like dance songs.
Nice.
And yeah, they got me going. Another celebrity with bipolar, we all know this one. Some of us don't love this one. Mel Gibson.
Yeah, wow.
Yeah. He was the sexiest man alive in 1985, which I feel like...
That's a long ass time ago, back when he was in his prime.
But I was going to say, he's not ugly now. He's just,
he's like...
He's zaddy material now.
Maybe how old is he? He's got to be in his late 60s by this point.
You can look that up for me if you'd like. But this photo that they have of him, that does not look like it's an old photo. It looks like it's relatively recent. He's still an attractive person. Demi Lovato was
we've heard,
diagnosed with bipolar. We have heard that about Selena as well, which I did cover in our episode on her.
Yep.
Russell Brand also came out as bipolar.
I can see that.
And one thing I want to say about a lot of these people, they've also struggled with addiction. And that's very common to have bipolar and struggle with addiction. Some of it is self-medication. Some of it is just difficulty regulating your use and can lead to addiction. Brian Wilson of the Beach Boys, he was quite famously bipolar. I believe it was at like the height of the Beach Boys. He had a full-out psychotic break.
Really?
Yes, and impacted their touring at many points in their life.
I was just listening to the radio and they were talking about like the best summer songs, like anything Beach Boys, pretty much anything.
There's a movie about specifically him and his mental health struggles while he was in the Beach Boys. I'm blanking on the name of it, but it does go really deeply into his mental health concerns. So I know it was a good movie. I didn't watch all of it. Supposedly, I'm not buying this one. They said Kurt Cobain had bipolar.
I don't know. We don't know enough to know. I
was going to say, and I don't feel like Kurt was open enough to necessarily share that. So I feel like it's probably conjecture.
Right.
They said he has ADHD. He had ADHD as a child, which that is actually a common misdiagnosis, is bipolar for ADHD, but more specifically in women. Women are more likely for their impulsivity to be labeled as manic symptom.
Right.
And then called bipolar versus it being ADHD. Not to say that men can't be, but when I see those two diagnoses, I always wonder, like, are we, not that you can't have both, but it's like, there's some overlap there.
Yeah.
And we do know that he had depression. I'm not going into the conspiracy theories about Kurt. No, I don't think Courtney did it.
No.
That's all I'm saying. That's all I'm saying. Another one who I don't know if he legit had it or just wrote a song about it, because you can write a song about it and it doesn't mean that you have it, but Jimi Hendrix.
Okay.
They said that he got expelled from high school, stole a car, only lasted a year in the army, and was they said he was early discharged. That's usually a dishonorable discharge, especially at the time where he was in the army, where people were going to war. They weren't discharging just anybody.
Right.
But he did write a song called Manic Depression, which described his difficulty with mood swings, but you can have mood swings and not have bipolar.
Right.
It really depends on the amount of mood swings, the severity of it. That's kind of what differentiates just a general mood swing from bipolar. But another person who was highly, highly talented, we lost him too soon. He's part of the 27 Club, which maybe we'll have to cover that at some point, because I feel like the younger folks don't know what the 27 Club is. Because there haven't been any 27-year-olds in a while, which is a good thing.
Yes, of course.
Brief explanation, 27 Club was a bunch of celebrities died at the age of 27. That's all I'm gonna say. And most of them tragically and suddenly.
Yeah.
Ernest Hemingway, I did know that was well documented that he had bipolar. He also had paranoia, but I think that was like more towards the end of his life. And he was very openly a florid alcoholic, which can cause also mood swings, depression, paranoia, things like that.
Yeah.
Ted Turner, who didn't he just pass recently? The head of Turner Broadcasting. I feel like he passed like this week, like very recently. Okay. Yeah, he was like 80 something, but he passed very recently. But he admitted to spending most of his life battling bipolar and depression. You can have both of those, but typically the bipolar kind of overrides the depression, but you can have just regular depressive episodes. Catherine Zeta-Jones, she's another one who I feel like has been open about her bipolar in the past. And awkward, but I feel like this was the timing of it. It doesn't say it in this article. I feel like she came out with bipolar at the same time that her husband said that he had mouth cancer because he was she had HPV. Which I'm like, okay, now we know where your mouth has been.
We all have HPV somewhere on us.
That's true.
Unless you were vaccinated, get your kids vaccinated. But
this is what he said. We don't know that for sure. We don't know that's where he got it.
I mean, head and neck cancer.
Where his mouth was.
Yes. Head and neck cancer is actually a combination of HPV and smoking.
And I feel like
causes.
I feel like Michael Douglas used to smoke. I don't know
Probably
for sure.
At some point in life, everybody did.
I feel like all of those celebrities of that age smoked.
Yeah.
Someone we've mentioned before, Vivian Leigh from Gone with the Wind.
Yes.
She had severe depression and mania and had electroshock therapy for much of her adult life.
Okay.
This one I don't know about, but I also don't know much about this person other than the obvious. Frank Sinatra, apparently.
Yeah, I don't know much about his personal life.
Yeah. Sinead O'Connor, which I feel like
I can
that tracks.
Yeah.
especially after that time she ripped up a picture of the Pope.
But that was a statement, so.
It was a political statement, but it also, like, apparently they said it wasn't planned. Like, she decided at last minute, like, right before she went on stage. So...
I mean, that's also like how Kurt Cobain played a song also on Saturday Night Live he wasn't supposed to play. So, remember?
But he wanted to play. He asked to play that song, and they denied him.
Yeah, I know.
So that was a little bit more, that was more of like an F you to the man.
Her child completed suicide as well as her?
No,
recently?
She died of cancer. She died of COPD. Well, her cause of death was listed as COPD. But yes, one of her children completed.
Her. It was not that long.
And she did openly say that she had bipolar and struggled with mental illness. So it's not unheard of, especially after a massive loss like that. But her cause of, and this article even says her cause of death was listed as COPD and bronchial asthma.
Okay.
This one I didn't know about, Jean-Claude Van Damme. And he said he'd been taking medication since childhood to manage mood swings.
Okay. Make sure he doesn't,
Yeah, he said he didn't
punch you
he
up.
didn't. Yeah, he says he didn't find out that he officially had bipolar until 1998, but he remembered being given childhood medication for mood swings in childhood. So
I think also our definitions and the way they were treating it and the way they were diagnosing have evolved.
And he is not from the States. So in Belgium, where he is from, they may have classified these things differently, medicated things differently as well. I don't know who that is, so I'm just going to scroll on past. I vaguely know who this person is. Patty Duke.
Oh, yeah.
She had bipolar.
She's also a parent of another famous person.
Wow.
Hold on.
That was the vaguest thing you could have ever said.
Hold on. Well,
all this tells me is that she played Helen Keller.
Sean asked it.
Really? Like Iceman from X-Men?
I know him from...
Wait, is he from Stranger Things?
And from Stranger Things, yes. And from Lord of the Rings.
Yes. I always confuse that Sean Astin with Sean somebody else.
Yeah, but Patty Duke was his mother. Yes, but she
I did not know that.
Yes.
I didn't know that was his mom.
Yeah.
WTF.
Yeah.
This last one, I think they're making shit up because I feel like this person would not tell people. Winston Churchill.
Okay.
I don't think Big Win was telling people.
Led things like he did if he was.
If
he's never portrayed in a way,
He's been portrayed as a mean person.
Right.
And they said that he battled his own war against depression, suicidal thoughts, and lack of sleep. So I'll get into the sleep issue. But the three of those in combination do feel a little bipolar-y, but it doesn't mean that you absolutely have it.
When I Google it, just says, severe depression, mood swings. He referred to as his black dog.
Yes, and this makes sense of why they maybe jumped to bipolar. He authored 43 books. That's manic AF.
He was a little bit, he was working hard. I picture how he's portrayed in The Crown by, what's his name? The actor
John
Lithgow.
Chef kiss.
So I can only picture him as John Lithgow now, not like the old-timey pictures of him. I can only picture him as John Lithgow.
John Lithgow is, I want to say he's a national treasure, but I don't think he's American, is he?
Is he Canadian?
He's played so many different types of people. I don't even know if we can claim him. I don't know if we can claim him, but he's a national treasure.
No, it says American actor.
Okay, well, John Lithgow, you are one of our American treasures. We thank you for all of your service, both real and fictional.
Yeah.
So I think those were all the celebrities. I said Selena already. And there'll be show notes, links about if you want to know more about these celebrities and when they discussed their illnesses, what battles that they've had. Because I do think it's inspiring that these people have been so open about that, because a lot of people, there is still a stigma about mental health in general. And then especially when you're a celebrity, you're expected to be perfect. So then to go out there and be like, look, I struggle with this. That's really brave of people.
Absolutely.
Linda Hamilton.
Okay.
Speaking of Stranger Things.
Yeah.
Although she's been in a million other things.
Yes.
We talked to, what? Okay, this can't be right. Sorry, I was scrolling. How old is Mariah Carey? Because I don't believe this article.
52.
57.
Oh, wow. Okay.
In my head, Mariah is 24 eternally, and I'm sure she loves me for that.
Yes.
Lily Allen, that's someone who has also been public about her struggles, which maybe this could be something for you to cover if you want. No pressure. Lily Allen has also been very public about her miscarriage and working through that, which I think she was one of the first celebrities like really openly talk about that stuff.
Okay.
Chappell Roan, who I know absolutely nothing about except for Pink Pony Club.
And she's cool. She's talented. That's about all I know.
Yeah. So those are the other folks in these other articles. So let me get down to brass tacks, as we call it. Oh, wait, there's another article with more. Oh, Halsey, who I feel like I know. We knew that. And now I think I'm confusing Halsey with who I just talked about as far as the miscarriage, unless both of them had it.
I don't know.
But I know Halsey has talked about it. I don't watch Vanderpump Rules. Do you?
No.
So apparently Jax Taylor on
Okay.
Vanderpump. I don't watch Vanderpump.
Yeah.
This person has done full-ass comedy sketches and an entire series and book about her bipolar. Maria Bamford. You may not know her by name, but if you saw her face or you heard her voice, you'd be like, I fucking know her. She's a comedian.
Okay.
But she had a full series on Netflix called Lady Dynamite.
I just Googled her. I do know her face.
Yeah.
Yes.
And she's been in a lot of stuff.
Mhm.
But if you're ever interested in knowing what the real life experience of bipolar is, but with like a comedy twist, watch Lady Dynamite. It is so beautifully done. Like there are scenes when like she's in a mental hospital and like in group therapy, but then when she's home after she's gotten out of treatment, and it's a really, really great show. Really bizarre at times, but I feel like that's part of the bipolar. Sometimes you have these bizarre ideas or these bizarre experiences and people don't get it.
Right.
But Lady Dynamite, chef kiss. It's so good. I feel like a lot of people slept on it. She's also written a book about it. I don't remember the name of the book. And she's talked about her bipolar in her stand-up a lot. I think we talked about everybody else. Alan Ritchson.
Richtman?
No. Ritchson. Says he's lead role in Prime Video's Reacher. I've never watched Reacher.
Sorry.
He's an actor.
Oh, I mean, I know of Reacher, but yeah, no.
Yeah. Sir Stephen Fry.
Okay.
Couldn't tell you who that is.
I know
it's
the
a guy.
name.
He's knighted. He's a sir.
Well, he's
so. And I guess that means he's also British because they're not knighting just anybody.
Nope.
Maria Bello.
Okay. I know the name.
She's an actress. She was on NCIS. She was in Coyote Ugly.
Okay. I'm just Googling everybody and then I see the face. I'm like, oh yeah, that person.
If I'm remembering correctly, Maria Bello was also stalked by a fan for years.
Oh.
Her and her daughter. And she recently started talking about it because I think the person has passed now, so she's no longer in danger. We talked about Maurice Bernard. He's another big one. He is an actor on General Hospital, and his bipolar actually started to interfere with some of his acting to the point that they actually wrote it into the show because he would have to take extended leaves for hospitalization. So they did eventually write it into the show that his character has bipolar, and a lot of that mirrored his own personal experiences of it. And he's still on the show to this day.
It's funny.
I also believe his sister also has bipolar. There was a recent interview with him and his sister.
Okay. It's just funny with soap operas because I'm so out of the loop and a lot of the ones aren't around anymore. But I was just in the nursing home the other day and there was a soap opera on TV and I'm like asking the lady, I'm like, which soap opera is this? It was like The Bold and the Beautiful. And I'm like, oh, I didn't even know that was still on.
Not that many are still on.
And she was like, yeah, but General Hospital's still going. I was like, oh, cool. Like she was cute. Like,
you know what you should have covered in your HIV/AIDS episode? There was a storyline on General Hospital where Robin got infected with HIV by her boyfriend who then passed from AIDS. And then somehow magically Robin went on to be able to be a nurse.
Yes.
And this was before there was the treatment there is now. So it didn't necessarily add up, but it was a soap opera. So whatever.
It's a soap opera.
So you guys are probably like, just tell me what the hell bipolar is because y'all been talking forever.
That's okay. We're keeping it light.
Yeah. So bipolar disorder, also sometimes called manic depressive illness or just manic depression. The formal term is bipolar. Those other two names are now outdated. It is a mental illness that causes clear shifts in mood, energy, activity levels, and concentration. There's often periods of ups, which is elation, irritability, energized behavior, which are often known as manic episodes, where everything is kind of on hyperdrive. And then it is often offset by very, very, very low lows. Sadness, indifference, hopeless periods, often suicide or self-harm. And those are known as the depressive episodes. But with both of those, both the mania and the depressive episodes, those are more significant than just like, say, you're anxious or you've got a lot of energy or you're impulsive or you're depressed. These are much more extreme differences. And people can cycle between the two of them, or they can just have a discrete manic episode, be at baseline for a while, and then have a discrete depressive episode or have multiple manic episodes in a row. So the presentation can vary somewhat, but those are kind of the two hallmarks, are those two shifts in mood.
I think we talked about this, they still all have cyclothymia though, as like a different category.
Yes, because so there's bipolar 1 and bipolar 2.
Yes.
So technically, I think cyclothymia would fall under bipolar 2.
Okay.
The difference is bipolar 2 is, instead of a manic episode, it's a hypomanic episode.
Right.
So it's a high, but not to that same extent.
Exactly.
And honestly, when we're looking at diagnosis, and especially first diagnosis, we tend to differentiate the two of bipolar 1, the more severe type. Those people tend to have been hospitalized because of their issues. Where bipolar 2, you might have some erratic behavior, might lose your job or lose relationships, but it hasn't led to you needing to be hospitalized. Now that can change, and it wouldn't change the diagnosis. It would just say, oh, it is actually bipolar 1, but when we had the initial information, we diagnosed it as 2 or cyclothymia or things like that. So some people can have psychosis during either one of those highs or low periods, which psychosis is hallucinations, delusions, and they tend to be either mood congruent or mood incongruent. So mood congruent means when you're manic and you're at the top and you're high, you think you're the shit. You're like God, nobody can touch you, you're amazing. Yes, grandiose. If it's mood incongruent, you're super high, but then you're just like, I can't stand myself. Everything's terrible. That person hates me and wants to kill me. So it doesn't match what the mood is. That's the difference. And it doesn't have to match the mood. It's just kind of how we differentiate those symptoms and clarify, especially treatment-wise. Because if you're working with someone who has mood incongruent psychosis, you can't necessarily reason with them until they get back to their stable reality testing.
Now, is being tangential considered part of this criteria? Like if you have somebody who is like so tangential, like you cannot keep them on track, does that feed into a diagnosis? I mean, obviously if they have other features, but is that a
honestly
symptom
depends
possibly?
on what you mean by tangential. So perfect example, today, my intakes take an hour. They give me 45 minutes. I take an hour. I had a woman this afternoon who showed up 20 minutes late, whatever. Her intake from the time it was supposed to start to the time we finished was 2 hours long.
Yeah.
Because she was so tangential.
Right.
But the tangents she went on were on the topic of what I was talking about.
Okay. Sometimes I'll like ask this question and then you'll start talking about this. And I'm like, wait.
So an example is I asked her, do you feel like you have anxiety? And she's like, yes, absolutely. And I was like, okay, tell me what symptoms of anxiety you have. And she's like, well, sometimes I get really nervous and I start thinking about things. And then, my sister has anxiety and my sister does this. And it's kind of going off course, but she's still on topic.
Right.
If we're talking about tangential in the nature of, technically it doesn't fall under tangential, but I think people call it that, is when you ask someone the same question, do you have anxiety? And they're like, oh yeah, I'm really anxious. And sometimes when I'm really anxious, I have to go to the bathroom. And then I go to the bathroom, my stomach hurts. And I think I have GI issues. And so I went to the GI doctor. That's off. So now that can be a symptom of ADHD. It can be a symptom of schizophrenia. So those are just singular symptoms. And even those symptoms can vary in the nature of what they are. There's also people who are just really disorganized in their thoughts.
There are. And or just like some people who love to talk. And that's just a whole nother
Exactly. And then there's this third level of tangential that is called circumstantial, where are you anxious? And they're like, well, anxiety, I don't know. That's a mood symptom. And sometimes I feel depressed and sometimes I'm really happy. And my mood today is really good. And sometimes, my mom's mood gets really bad. But, if she's in a good mood, then I'm in a good mood. So no, I don't think I have anxiety.
You're really good at this. You're really good at giving these examples.
I deal with this every day.
I have a few handful of people, that have to keep writing. Patient tangential, very difficult to keep on task. I have to keep writing that.
So with that one, I went way off, but I finally made my way back.
Right. You circled back.
The issue is, though, for some people that can take quite a long time. So you might just be cut off before you got back to the point.
Right.
Also, circumstantial can also be depending on what the question is. They may not do that with another question that's more direct. So it can be a little bit more inconsistent. And that level of circumstantiality, that's not even a word, just made it up. Tangentiality, the more significant it is, it tends to be more of a significant symptom of a more serious mental illness versus somebody who's just not paying attention or who's really chatty. I don't know if you remember.
I took you on a tangent right there. Sorry.
You did. I don't know if you remember, but we definitely watched it in Miss Lucich's class in high school. It was an interview with a homeless man in a bus station. He had schizophrenia and they were interviewing him and he was great. He seemed very intelligent, was talking. And then in the middle of the things he was saying, he would just say mango.
This sounds familiar.
Yeah. So he'd be like talking like we're talking in mango, and then he'd say something else, and then he'd be like mango. But it was almost like a verbal tick. Because he didn't even realize he was saying the word, but it had nothing to do with anything else. They were showing in the context of schizophrenia, but now working in the field and knowing it, I don't know if that's necessarily what that symptom was. He definitely had schizophrenia.
Right.
But I feel like that could have been more of, like I said, a verbal tick or something else going on.
Okay.
Yeah. It could also be a sign of a head injury, just kind of blurting things out that are inconsistent with what's going on. So that's bipolar. I feel like we've talked about medications for bipolar before.
We did talk a little bit about lithium, obviously.
Yes. So lithium, I feel like a lot of people think it is the first line of treatment, but it's actually not because of so many side effects.
Yeah.
There's the risk of lithium toxicity and things like that. So it is a treatment, but most prescribers are going to be really cautious with that and try other things first. But essentially, it's going to be some sort of mood stabilizer to keep someone more even, because that's going to address taking you down when you're manic, but also boosting you up if you're depressed. That being said, if your initial try of medication is a misdiagnosis and you're only diagnosed with anxiety or only diagnosed with depression, some of those meds can call what we call rapid cycling.
Yep.
So now you're manic on a Monday and depressed on a Tuesday, but that's due to the medication.
Right. So that's why we don't
system.
Use most SSRIs in somebody you suspect is bipolar, because that could put them into one of those. The only one I think that they use is fluoxetine, can be used in combination with olanzapine for bipolar. But other than that, if you mistakenly have somebody who just says I'm anxious and depressed, and you put them on a regular SSRI, you might cause more harm than good.
And that's really why doing a really good, thorough background, getting good information on symptoms, not just from the patient, but collaterals if you can, because since it can cause that side effect, you don't want to put someone into that crisis, which can then lead to hospitalization or problems like that. But also, if you think about if someone's very young and presenting for the first time, they may only have had a manic episode and nothing else. So that could easily get misdiagnosed as something else just because nothing else has happened yet. So bipolar, with many mental illnesses, tends to spark up around late teens, early 20s. I think part of it is, if we think about in context of life, this is when people are expected to be more independent. They're on their own. So maybe they don't have as much support or people keeping an eye on them. And so then you're more willing to take those risks when you're manic or get into trouble like that. Or if you don't have that support, you feel more alone, you may fall more into those depressive episodes. That's not what causes it biologically, but I think that's why we see some of those things then, because of those life transitions that are happening around that time as well. I feel like I'm forgetting a big thing about bipolar. You tell me.
I mean, the mood disorder questionnaire is a great starting point for somebody who's not being formally assessed. So that's something that you can answer online, answer with your primary, and then get the next steps. So that's something
and
you
that's
can
just
look
a screener. So if you're looking online and you're taking that, it's not going to give you a formal diagnosis. You can only get that from a licensed provider.
Exactly.
But it can at least give you something to make a talking point when you go in to talk to someone.
Exactly. So that's something. And then basically, I know that there's certain periods of time, it has to happen over 6 months. What is the criteria here? I'm looking at the criteria.
I think the initial episode
has to last at least 1 week and present most of the day, nearly every day. During this period of mood disturbance or activity, energy or activity, there's too many things in the criteria. I'm looking at the DSM. DSM has a lot of things.
Get out of my book.
Yeah, but essentially part of it too is that it has to affect your life, because if it doesn't affect your life, then it's not specifically that.
Every single thing in the DSM. If you're not experiencing occupational, academic, or social impairments, you're not going to meet criteria. Doesn't mean that you don't have some stuff going on that you should address, but it's not rising to the level of diagnosis. And I think that's what a lot of people in general, when they go to seek a mental health diagnosis, they're like, oh, well, I watched this TikTok and I have those symptoms. But is it impairing your life?
Right.
That's the main difference.
And not attributable to another medical illness, drug, medication, some other something extraneous too.
Yeah. The other similar ones, we talked about depression, we talked about cyclothymia, schizoaffective disorder, which that's a whole another animal in and of itself, borderline personality disorder. We've talked a little bit about personality disorders before. ADHD, like I was just saying, because the impulsivity of ADHD can mimic mania. Especially depending on where it is. I feel like with women, when, providers are asking questions, they tend to hyper-focus on, I do a lot of shopping. Is it impulsive shopping or is it the bipolar type of shopping? So there's a book, I'm blanking on the name, and I'm going to kick myself in the butt because it's a really good book. It's by Kay Redfield Johnson. I know that, and I rarely remember authors. She has bipolar, and she gives the most perfect example of the manic type of shopping. She bought something like 150 snake bite kits. She had no plans to go anywhere that needed.
Right.
It wasn't like I went shopping and I bought this bag I've been looking at, and then cute shoes and an outfit, and then I bought makeup and everything
An
like that.
Unquiet Mind, is that the book?
Yes, that's it.
I Googled it for you.
Thank you for that.
But that is you wake up one day and there's 1,000 things on your porch and you're like, wait, I bought those.
Yeah.
Have you gambling? That's a big one.
Mm-hmm. basically any high-risk behavior. It can be driving very fast. It can be
Yes.
increased sexual behavior as well.
Yes.
Yeah.
Yeah. And, to the point where it's going to then roll down and cause other issues later,
Exactly. Exactly.
Like if you're rich as hell and you're gambling and you don't care,
You've lost
well,
all
that's
your
different.
money. But then if you've lost all your money,
right.
and now you're broke.
Right. That's a problem.
Yeah. Other things that medical diagnoses that, depending on the symptom presentation, may be mistaken for bipolar or vice versa. Seizure disorders, depending on the type of seizures you're having or the presentation of that. Central nervous system infections, not infections, that's different. Infections, like HIV, certain symptoms of that. You can have some of those symptoms. Traumatic brain injuries and certain endocrine disorders like thyroid disease and Cushing's syndrome, which I know very little about Cushing's, but I've heard it mentioned enough that I know it's something that sometimes...
Cushing's is the real disease with cortisol that's a problem, but don't come to your provider and be like, I feel like
everybody says their cortisol's off.
Checked. Yeah, no.
My cortisol's off too. But
Cushing's is moon phases. You have stretch marks. You have a buffalo hump. You have, like there's just a whole lot more to it than, I'm tired. I want my cortisol checked.
Yeah. Let me make sure we talked about medications and being careful about that.
How about reduced sleep? That's a huge one, right?
So that's part of the manic phase.
Yeah.
And when I'm saying reduced sleep, I'm not saying like, I can't fall asleep, I'm tired.
No,
I'm saying I have energy and I'm not sleeping for 72 or more hours in a row.
Like I stayed up for 3 days and reorganized my closet and cleaned my house for no apparent reason.
Exactly. And read an entire novel and then wrote a paper on it for no reason.
I mean, I wish I had that kind of energy, but not in the pathologic way.
But I'm glad you say that because I think a lot of people who do truly have bipolar, sometimes there are things about their manic episodes that they enjoy. They're much more productive. They're much more creative. And so sometimes they want that, especially if you're creative and now you're hitting a lull and you can't get anything done. And now maybe there's a deadline looming or you miss that creative part of yourself. There can be, that want of having that feeling again, as negative as it can be.
Yeah.
There's something else I was going to say, and then you said that, and I got distracted.
Sorry.
No, you're not.
My tangential.
Your circumstantial tangentials.
Yeah.
Other treatments can be, regular talk therapy. You want to do that more when someone is in that stable or in between phase, because if you're truly manic,
it's not productive.
That's not going to be as productive. You can do it, but you're not going to see as much impact for that. It's not a first line treatment, but electroshock therapy has been used for people who, what we call have intractable. So they've tried many medications. There is no improvement.
Right.
Then we might want to try that. And I'm talking, this is after a long course of lithium or something like that.
Right.
And it's
pretty far down the algorithm.
Yeah. Or if maybe you have an allergy to lithium and that's not an option for you, but you've exhausted everything else, then you would look at that stuff.
Yep.
But cognitive behavioral therapy, there's this thing here I've never heard of, interpersonal and social rhythm therapy. Sounds interesting. Family focused therapy, which I think is really important because sometimes when you're in that really low or that really high, you do need that social support to kind of pull you in and get you better. So it's important to have that social support. We talked about
how about running in families? Because I feel like this is something that does run in families a little more than some others, at least anecdotally. I don't know statistically.
Yeah, I was going to say, I don't know if we have genetic identifiers for it.
No. Yeah.
But for a lot of mental health things, we don't have the explicit it runs on this gene and this is what happens or it's this mutation. But we do know that it can run in families.
It says is highly heritable with genetics accounting for 60 to 85%. Having a first-degree relative, a parent or sibling, increases your lifetime risk 15 to 30% compared to 0.5 to 1% in the general population. So
there's a book.
Okay.
It was on Oprah's favorite list. I did not read it, but it was a true story. It was a twin, and her identical twin had bipolar, but she did not.
Mm-hmm.
And it was talking about, I believe they were involved in a research study at some point, but just talking about
nature nurture stuff, all those twin studies. We love those.
Yes.
I definitely have family members, and famously my grandmother, who's been gone many, 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 many moons ago. My whole life I knew that. Like, I didn't see much of it because, I was a little kid, but I was told I knew what it was. They called it manic depression back then, but she used to get on a plane and be somewhere else just randomly.
Just pick up and go on a trip somewhere.
Yeah, just
or
things
fall
like
off the
that.
face of the earth. Yeah.
Through my lifetime, she was as far as I could tell, stabilized. Like I said, I was a kid, but then I definitely do know other family members too. So I definitely see that passing down, and genetics, genetics
It definitely
combined with other
trends towards
things,
that.
right? Combined with other environmental factors and other things.
Yeah. I was going to talk about something, but I was confusing it with schizophrenia, so I'm glad I didn't say it.
Okay.
I was going to talk about neurological differences, but that's schizophrenia with the ventricles, not in bipolar.
But in general, the creativity thing, like you've touched on a little bit. I mean, I can totally see that being like, I need to write a song, and I'm in a manic state, and the best song I ever wrote was in that state. Like I could see that happening.
Yeah, absolutely. And that's the thing too, is because someone has bipolar, they're really feeling those emotions very deeply. And that's really what the core of creativity in any field is making that emotional connection to those experiences and being able to share that experience with someone else. So whether you're, a classical violinist or an actor or an author, if you can really tap into those emotions, it can really enhance your art.
Right.
So it can be helpful, but if you're not managing it well, you're going to end up crashing at some point. Yeah. And you don't want to blow up your life over it if you're not managing it very well. But I think that's another reason why a lot of people go off their meds, not just because they feel good, because they feel like they're less creative.
Right. Right.
And so then you lose out on stuff. If I'm remembering correctly, Girl Interrupted.
Yeah.
Susanna Kaysen. I think I'm confusing two names of people. She had bipolar. The main character in Girl Interrupted, plus whoever the character that Angelina Jolie plays also has bipolar. They have very different presentations, though. Angelina Jolie's character is more of the reckless, wild, manic type of person, where Winona Ryder's character is more the depressive, lower mood character. Yeah. Which we've never talked about Girl Interrupted.
Yeah.
Yeah, it's such a good movie. And I love how they cover eating disorders in that, too, and the psychosis that goes along with eating disorders, which is very rare. People don't talk about that.
Yeah, we know
Brittany
Winona
Murphy.
Brittany
May she rest in
Murphy.
peace.
Jared Leto, Vanessa Redgrave, Whoopi Goldberg, Angela Bettis. I mean, there's a lot.
There were a lot of big names in that movie.
Yeah. Elizabeth Moss.
And it was based on a true story.
Yeah. Yeah.
I mean, loosely based, but still.
Yeah.
Another book about bipolar. It's a classic, The Bell Jar by Cynthia Plath.
Yes.
I read that way too young.
Yeah.
I should not have read that when I was like 9, but I did. And it spoke to me, maybe that's why
set you on your path. There you go.
Yeah. I don't even know how I got that book, but I read it when I was very young. I mean, I went to the library a lot. No one's screening your books.
Yeah, exactly.
It's not like you're getting porn at the library, so nobody else is looking otherwise.
That's funny.
I'm not going to go into the pathophysiology, but GABA.
Receptor-y things.
GABA receptors. Gamma aminobutyric acid and glutamate. Those are some of the neurotransmitters involved in bipolar disorder, including dopamine, serotonin, and norepinephrine. Tell me why. I feel like it's on TikTok and it's just not on my feed. Everybody comes in talking to me about needing a dopamine hit. I'm like, how do y'all know what dopamine is? And I don't think you're using the terms correctly.
They colloquially understand that dopamine is the feel-good chemical that you get from something. And
or people tell me about dopamine dressing. I'm like, you just look cute. It's not dopamine dressing. You just look real cute. And that's fine. You can be real cute, but it's not stimulating anything in your brain. Just because you wore all pink today, you just cute. That's it.
I have no idea. Not my feed.
Yeah, so that's all I mean, it's not even my feet. Like, I have patients come in and say, like, oh, well, I just needed the dopamine hit, so that's why I watched Housewives for 6 hours. I was like, well, so did I, but I didn't get any dopamine out of it.
I don't feel like that's dopamine. I feel like...
I mean, if you really like it, then it is. But, like, I watch it because I'm being lazy. I don't feel like doing anything.
Yeah.
So it is what it is. I feel like a lot of people confuse the idea of a dopamine hit with needing stimulation.
Yes.
Like, you can be bored and need to do something. That's not the same thing as a dopamine hit.
Right.
And yes, dopamine is involved when now you're excited about something, but it's not a singular concept.
Right. I know.
So that's all I got. I'm sweating. It's hot up here.
I'm sorry. I'm still wearing my sweatshirt.
I know. She's in sweats and I'm dying in here because it's 92 degrees. Anyway.
All right. So thank you for listening to Medical Media Mixer.
The perfect cocktail.
Cheers. My wine is all gone.
How dare you cheers with an empty glass? What's wrong with you?
I can drink my seltzer if you'd like.
It's better than cheersing with water.
I mean, it's a non-alcoholic seltzer.
I'll take it.
Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon, patreon.com/Medical Media Mixer Podcast, and on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.